Okay, we've got a bundle of hairs here coming out. So that is a ton of hair coming out of that small hole. I don't know where on the body this is, but she keeps fishing out these big spools of hair. Dead skin cells all wound around there. She's a great one to follow if you guys love this stuff. Bare and neutral. She's got TikTok, Instagram, YouTube. So shout out there. Good job. So this just keeps going, I think. Okay, we got a new patient. Very good. Boom. That's a ton of hair. So it just doesn't have an exit to the skin. It keeps producing hair and it just winds up in a spool with dead skin cells, with oil, all sorts of gross stuff. But it's nice for the patients to get these taken out of there. Probably a little bit tender when they do. But this is great. Comedone extractor, well done. All right, we've got one on the back of the ear here. And no gloves, -1. We've got some dirty fingernails. They've got hangnails, all of that stuff. These are just not ideal to do at home. Can't recommend it. It looks like we're on the back of the ear again. I'm telling you guys, this is a common spot. We still don't have any gloves on. There's dirt under the fingernails. Do better. Just got to do better than this. Clean the area, wear gloves. Ideally go see the doc, but it's what it is. Don't know if this is in a medical setting here. We've got at least a good looking tool here. It looks like it may be dirty. It's the right kind of tool. Pulling that hair out, the pustule is still intact. Are we gonna come back and we're gonna pop it? Yep, they're just gonna squeeze the top and rip it open. So I'm not guessing that this is in a clinic, if I had to wager. And that skin's being stubborn. They're gonna rip it open and then they're gonna squeeze it. Here it starts to come. They got it ripped open. They're grabbing the hair next to it. There's no reason to pull that out. Guys that get ingrown hairs on the neck struggle with this for years. It can do with, you know, how you shave, what kind of razor you use, but they're obviously tender. This person's letting it grow for a little bit and they're coming in and plucking out those ingrown hairs. They've got pustules around there, probably just with normal skin bacteria. I prescribe like topical clindamycin. It's an antibiotic for patients that struggle with this kind of thing on their neck. Sometimes a very mild topical steroid, but this is just being done at home, it looks like, because we got no gloves, we got the dirty nails. Not the right way to do it. We're switching it up a little bit here. This is an ingrown toenail, and coming at it with some pliers. It does not look like it's been cleaned or anything like that. This is not a medical setting, as far as I can tell. And they're just trying to tease it out of there. The chances are this is pretty painful for the patient. It's in there kind of deep. You can see that they're struggling to get it out, but and they're just trying to wedge it out of there, like wiggling a loose tooth. Slowly getting it out. We're gonna see if they finally make it all the way. Twisting it, that's gonna hurt. I don't know if they're doing this to themselves or if somebody else is doing it. There's got to be more than one person here. Somebody's holding the camera. You got to hold your foot up. You got to hold the tweezers. At least the camera's staying still. Maybe they have it on a mount. Who knows? There we go. It looks like we're behind the ear here. We've got a little needle to kind of open up these comedones, and they're going to be expressing them. I love these kind. They're not inflamed. They're using gloves. This is the right way to do it. And then just a little gentle pressure. For some reason, behind the ear is a common spot to get these pimples. It's not a common spot that you're going to use retinol or anything either. You could wash with a salicylic acid based cleanser back here, but this is enjoyable. When it turns black like that, it's because that sebum and oil is oxidized from exposure to the air. I love the magnified view, and this one's actually pretty full. It just keeps coming. They're using good, gentle technique. I've seen a lot from this channel. I think this is from Vietnam. That one looks like a little worm coming out. Now we've got a comedone extractor. This little tool applies gentle pressure around the outside So the idea is that you don't pop the sac underneath the skin and get stuff coming out there, which will lead to inflammation. Came out beautifully. Well done. This is a blind reaction. So satisfied. This is a hair splinter. This hair was completely under the skin, and you couldn't tell until I pulled it out, is what it says. You can see it like weaving up underneath the skin. Boom! That was long. There we go. That's great. All right, another blind react here. It looks like an ingrown hair right behind the ear, back of the scalp. They've shaved the area. It's clean. They're not using gloves, but that's a lot of hair in there. That's like a whole ball of hair. Gross. I always love these with the great big nails. And now we've got tweezers. Okay, we're not just using the nails, but that's a really impacted hair. Look at that. Oh, that is thick. I get excited about these. All right, we got an ingrown hair on the neck, it looks like. Not a ton in there, but they're using the tweezers. I like the technique. No gloves, but they're doing this at home. Don't expect them to have gloves. Hopefully they clean the tweezers. This one's a little bit longer. We're using gloves. We've got gauze, and they're just applying gentle pressure on the outside of this blackhead. It's a really small hole, so they would benefit from opening that up a little bit with a stylet or a needle or an 11 blade. So this person was shaving the area, got some ingrown hairs, and ended up with this kind of big comedone. But this is the Indigo Aura Spa. She's using good tools to get that out. So at a spa that does waxing, a lot of times they legally can't use the stylets and things, so they can only do the expression. So once you pierce the skin with a tool, that's getting into the practice of medicine, so they can't legally do that. So she's doing the best that she can here in a very sensitive area, and hopefully the patient tolerates that well. So she's being as gentle as she can with the patient to not hurt her. All right, so we have all that compacted keratin, and that's just sitting over the top of an ingrown hair that we're going to see here shortly. Oh, there we go. That is long. Look at that. This probably was from shaving without proper exfoliation. That is impressive. Pure excitement. I feel it. There we go. We got more of the keratin and stuff. Of course, this is going to be at risk for coming back because there's a little small cavity under there. So hopefully it seals itself up and doesn't come back for this person. Oh, there's more hair. Aha. Now I'm super satisfied. So she did return, the patient came back, and everything was doing better. Next on deck is an ingrown hair, pimple, something going on the back of the neck, it looks like. Short video here, so let's see if they can get it out. There's a little pus. Come on. Boom, got it out. All right, 30 seconds, let's go. The toe was hurting, they decided to check it out. What is going on between the toes? There by the little piggy. They've got the tweezers, they're going in. Hair splinter. These are common for people that walk around barefoot with pets or people that work in hair salons or barbershops. And get them on the feet, between the toes. Nice. Quick video here, scrubbing the back of the scalp. There's blood. I think they cut them to heck when they were doing the fade. Is that alcohol? That's gonna burn like crazy. Oh. All right, big ingrown hair here, 16 seconds. Let's take a look at it. Back of the neck, common area for ingrown hairs. Going at it with the tweezers. It looks like they have gloves. Did I miss that? Look at that. That is massive. That is massive. Oh, that's gonna feel better. All right, this one is a minute long. This is a big abscess over the eyebrow. Pushing on it with gauze or toilet paper, probably toilet paper, honestly. And it's just draining purulent material. We got an infection here. Oh, I did not see that coming. That was massive. Now we're in front of the ear. And there's a pimple cyst on the ear. This is gonna spray everywhere, I know it. They're just pushing on the back of the ear, getting in there. Is it gonna pop? It's gotta pop, come on. Boom! We're getting some projectile pus all over the fingers. Now we're on like the abdomen. It's all infected, look at that. Ooh, that's painful. You know that's painful. Oh, these are all shooting all over. Now on the foot. This one's gotta be fake. I think I've seen this before. I think they're holding something there because I don't know how you could get that much stuff out of the bottom of the foot.